150 people in Florida are being monitored this morning for coronavirus. That's a significant drop from the 700 people who were at one time under investigation. 15 people have tested negative for the deadly illness. And as of this morning, the state has not confirmed any cases. Meanwhile, the CDC is releasing new guidelines regarding who can be tested. Jacksonville hospitals are preparing as a precaution. Joining me now with more is Dr. Alexis Vazquez, a pulmonologist with Jacksonville Memorial Hospital. Thank you so much for being here this morning.
Pleasure to be here.
We've been talking about the coronavirus for quite some time now, and now that we are starting to see cases pop up here in the United States, what do people in Florida need to be aware of?
You need to be aware of the virus is out there. It's still very well contained. There's only about 3 or 4 cases here in the United States. In Florida, there is no cases. In Jacksonville, there has been no cases. There's about 150 people that are being monitored for the coronavirus, but as of today, there's 0 cases throughout Florida.
And China was ground zero for this. How, in a sense, did that help us here in the United States that we weren't ground zero for this virus?
It makes all the difference because we see what's coming. We can learn from their mistakes. We can see what the patients had, how the disease progressed, and now we're taking preventive measures. Now our states and our governments have testing to go at it a lot quicker and diagnose symptoms a lot quicker.
And talking about some of those preventative measures, how are hospitals prepared or continuing to prepare for this virus as we see some cases in the U.S.?
Sure. The hospital, what they're doing now, they're actually now having the testing involved. They have testing and they have protocols in place where they see a patient that may look very similar to the flu and may have symptoms of fever, shortness of breath, and they're getting tested a lot sooner and quarantining as well patients that they may think that may have the coronavirus.
And for people day to day, what are some of the preventative measures that they should be taking?
So as I advise my patients, my family, is hand hygiene. That is key for anything, especially now, not only for the coronavirus, we're in the flu season. And what I tell my patients is make sure you clean your hands over and over. Hand sanitation is key to prevent most of these illnesses.
And we have the different masks here. I know there's been a lot of talk with this virus going around about what masks work and what masks don't. Kind of explain the difference between these two.
Sure. So this is the typical mask you probably find in most pharmacy stores. This is the other one that most hospitals will have, and this is N90 where it has a little laps here on the top and actually it fits snug to your nose. But once again, the mask is not 100%.
Right.
It's actually more utilized for patients who actually have the disease from not allowing them to give it to other patients. But it's not 100% the mask because the spores can still go through there.
And real quickly before we go, what is your message today where the coronavirus stands to those living in our area?
So at this point, there is no risk. We essentially have no patients in the whole state of Florida that has the coronavirus. That being said, there is obviously the possibility of several cases that can pop up because people come in and out of Florida. But as of this moment, hand hygiene, be aware. If you start having fever, chills, you go to the hospital, get tested for it. But at this particular moment, I think we're safe.
All good things to know. Thank you very much for joining us this morning. We'll continue to follow the latest updates on the coronavirus abroad and here in the United States. You can head to our website, news4jax.com, for more information.